So at this time, I'm going to go ahead and complete your head-to-toe physical assessment. Okay. So I'm going to actually start with your hands. The temperature is warm. They're cool. There's no lesions present, and there's no clubbing or cyanosis of the fingernails. The capryl is brisk. I'm going to assess your pulses, checking the radial pulses. They are 2+ bilaterally and relaxed. Checking your brachial pulses. They're also 2+ bilaterally. I'm checking your upper arms for any deformities, any lesions on the skin. Okay. And then I'm going to assess your range of motion in your hands. I'm going to have you wiggle your fingers and your thumbs and make a fist and out, and your wrists up and down, side to side, and your elbows up and down. And if you can flip your arms over this way, and if you could do your shoulders, arms this way and down, and out in front of you, and down, and up back behind you, and back behind you this way. Okay, great. And then I'm going to have you shrug your shoulders. And I'm actually going to have you flex your biceps up towards you. I'm going to hold here. Okay, and then away. Okay, good job. Go ahead and squeeze my hands. And I'm going to test your rapid alternating movements. If you can touch your thumb to your fingers. And close your eyes and hold your hands out in front of you. And then touch your finger to your nose. And then the other side. Okay, good. Relax. And now I'm going to assess your head. If you don't mind taking your glasses off. Thank you. I'm checking your scalp. Hair distribution is even. There's no lesions present, no deformities. I'm checking your face. It appears symmetrical. I'm going to palpate your sinuses. Tell me if there's any tenderness. Any tenderness?
No.
And here? Any tenderness?
No.
Okay. And if you can show me your teeth and stick your tongue out and puff your cheeks. Okay, good job. And then I'm going to assess your eyes. If you can close your eyes, I'm going to palpate gently for any pressure. Okay. And go ahead and open. And I'm going to go ahead and shine a light in your eyes. If you can just look straight at me. And I'm checking for a direct and consensual response. And the pupils are equal, round, reactive to light, and accommodation. If you could look up, I'm going to pull your eyelids down. Up. And the conjunctiva are pink, square, clear. There's no drainage present. And I'm going to test your field of vision. You can follow my finger. Okay. On tap. I'm going to go ahead. I would complete my ophthalmoscope exam at this time. However, I do not have one. I'd be checking for the red reflex as well as looking for the optic disc and any vessels. Then I'd go ahead and move on to your nose. So it appears symmetrical. I'm just going to palpate gently. And I'm going to assess patency. If you could breathe in one nostril. Okay, on the other side. Very good. And I'm also going to go ahead and look in your nose. If you can lean your, tilt your head back for me. The mucosa are pink and intact. There's no swelling noted. Go ahead and relax. I'm going to go ahead and assess your ears. So I'm just looking for any irregularities, pocketing, or any lumps, deformities. And then I'll go ahead and complete the otoscope exam and look for the temporal membrane, or tympanic membrane, and check, make sure it's not bulging, there's no drainage present. I'm going to test your hearing with the whisper test. I'm going to whisper 3 numbers. If you can just repeat the 3 numbers, okay?
721 393.
Okay. And then I would also complete the Weber exam and hit my tuning fork and then place it on your head and make sure that you can hear equally on both sides. Then I'm going to move on to your mouth. I'm just looking at the lips for any lesions. They appear pink and moist. If you can open. And I'm checking your palate for any ulcers or any bleeding. 2+ bilaterally. Next, I'm going to go ahead and assess your neck. Well, first let me do your test for TMJ. Open and close your mouth. Okay, and then I'm going to listen to your temporal arteries for any bruit. No bruit is present, and I'm also going to go ahead and listen to your carotid. Okay. No bruit is present there either. I'm also going to go ahead and palpate your carotid pulse. And on this side. Okay, and it's 2+ bilaterally. I'm going to make sure that your trachea is midline. I'm going to place my finger here. Okay, and then I'm also just going to palpate for any lumps or tenderness. I'm also going to palpate your lymph nodes. So I'm going to test your preauricular, postauricular. I'm going to have you turn your head this way and do your superficial cervical, deep cervical, posterior cervical, and supraclavicular, and then same thing on the other side. We have the superficial cervical, deep cervical, posterior cervical, and supraclavicular. Any tenderness anywhere?
No.
Okay. And so I'm going to check the range of motion in your neck. If you can nod your head for me, and then do it side to side this way. Then I'm going to have you turn your head against my hand, and on the other side. For the next portion of the exam, I'm going to go ahead and have you take your shirt off, and I'm going to assess your back. So you can sit facing this direction for me. Okay. At this time, I'm going to go ahead and assess your thyroid gland. So I'm just going to place my hands on your neck, and if you can swallow for me. Okay, and I don't feel any lumps. Next, I'm going to just assess your back, and I'm looking, it appears symmetrical. I don't see any work of breathing or accessory muscle usage. I'm going to test your axillary lymph nodes, or check your axillary lymph nodes. I'm going to put my hands under your arms. Any tenderness?
No.
Okay. And I'm going to go ahead and sanitize my hands. And then next, I'm going to check your breathing and make sure it's symmetrical. So I'm just going to place my hands on your back here. And then if you could take a deep breath for me. And expansion is equal on both sides. Next, I'm going to go ahead and percuss your back. So just a light tapping. And the lung sounds are resonant throughout. Next, I'm going to listen to your back from the oscilloscope. Listening to the lung fields. Okay, just breathe in and out at your own pace. Listen to your lateral lung sounds on your sides. And on the other side. just going to test for any crossovertebral angle tenderness. I'm going to feel a thump. Tell me if it's painful.
No.
Anything? Okay. And then I'll go ahead and have you turn back towards me. And actually, go ahead and lay down here. Okay. At this time, I'm going to check your precordia. I'm looking for any heaves, pulsations. I'm going to palpate lightly. And there's no lumps present. I'm going to go ahead and listen to your heart also. I'm going to listen to your lungs first. Okay, now I'm going to listen to your heart. I'm listening to the pulmonic, aortic, verse, tricuspid, and mitral zones. And then I'll have you turn towards me, and I'm going to listen to those same zones for listening for a bruit. So I have the pulmonic, aortic, verse, tricuspid, and mitral. Alright, you can go ahead and lay back on your back. I'm also going to feel for your point of maximum impulse. And your heart rate is regular. I would go ahead and count here for just 30 seconds, multiplied times 2 to get your rhythm, or your rate. Then I'm going to go ahead and also palpate your chest for any lumps. Okay, now I'm going to move on to your abdomen. I'm looking at your abdomen from eye level. It appears flat. There's no distension noted. I'm going to first listen to vowel sounds in all 4 quadrants. Vowel sounds are active times 4. Next, I'm just going to press on your stomach. Tell me if you feel any tenderness. No tenderness?
No.
I'm going to palpate a little bit deeper. I'm feeling for any masses, feeling for the liver. Here, there's no hepatomegaly. And this side, same thing. And feeling for the spleen, and there's no splenomegaly present. Any tenderness anywhere?
No.
Okay. I'm also going to go ahead and percuss your abdomen. Okay, and then I'm going to listen for a buoy in any of your arteries. Listen to the aortic. And the renal. And the iliac. And there's no bruits present. Next, I'm going to go ahead and assess your femoral pulses. And those are 2+ bilaterally, and I'm going to test your inguinal lymph nodes. Any tenderness? And there's no hernias present either. And now I'm going to go ahead and move on to your legs. Looking at your hair distribution, it's even. There's no lesions noted, no lumps I'm just going to palpate for any deformities. The skin is warm and intact. Also assessing for any edema, none is noted there. I'm going to look at your cap refill. It appears brisk. There's no irregularities of the nails, the toenails, and I'm gonna sanitize my hands again. And I'm gonna check your pulses. I'm gonna check your pedal pulse, as well as your tibial pulse. And those are 2+ bilaterally. Next, I'm going to check the range of motion in your legs. If you can do like a snow angel and put your legs out and back in. And then I'm just going to have you cross this leg over this way. Okay, and then the other side. Okay, and then I'm going to have you do it back the other direction. Great, and then the other side. Good job. And then if you could bend your knee up towards you. Okay, and back down. And the other side. And back down. Okay, great. And then in your feet, if you can pull your feet up towards you, both feet, and then down like on the brakes, and then in towards each other and out away from each other. Very good. I'll go ahead and have you sit up to the side of the bed now. And I'm going to test your reflexes in your legs with my reflex hammer. If I did have it, I would be testing the patellar reflex here, as well as the Achilles reflex down here. I can test your Babinski reflex, and it is negative. I'm also going to test the reflexes in your arms, if I did not do that already. And so I'm assessing your brachial here, your biceps here, your triceps here, and your brachioradial, and I'll be doing that on both sides. Next, I'm going to have you go ahead and stand up for me. If you can close your eyes, checking for a Romberg sign, and go ahead and open your eyes. And if you can turn and walk that direction, just a regular walk, checking your gait, it's appropriate and even, and back towards me. Very good. And then I'm going to have you walk that way heel toe. With your heels to your toes towards you. Great. And then I'm going to have you walk that way on your heels. And then back towards me on your toes. Okay, and your balance and gait are appropriate. Now I'm just going to assess your spine. Go ahead and spin around for me. And your scapula are even, iliac crests are even. I don't see any lordosis or kyphosis noted. And if you can bend towards your toes and back towards me this way, and then to the side and the other side. And if you can rotate. Yes, perfect. Okay, and that concludes our examination. Do you have any questions for me at this time?
No questions.
Okay, well you can go ahead and get dressed.
Thank you.
You.